Doctors across Spain came out in their thousands for a 24-hour nationwide strike. Medics are calling for better working conditions and more health spending as the number of COVID-19 cases continue to rise. Spain, with more than 1 million cases and 35,000 deaths, is one of the worst affected countries in Europe.
We are now in the middle of the second wave now in Spain, and especially in Madrid. All the health workers are very exhausted because we are very tired from the first wave, and we're tired both physically and mentally. There is not enough COVID tracers. We have not making enough PCR tests. Clearly, social and confinement measures were come late. We feel completely abandoned from our politicians.
After years of health service cuts and after battling on the front line of the coronavirus pandemic in the spring, doctors are taking action. They are demanding better conditions and improved safety before they are immersed in the second wave of COVID-19.
The strike came as the Spanish government unveiled its budget for 2021, where they promised a 150% increase in health spending. The coalition government, led by Pedro Sánchez, has already imposed a state of emergency, giving central government sweeping powers, including restrictions on freedom of movement. A curfew has been introduced from 11 p.m. until 6 a.m. everywhere except the Canary Islands. The state of emergency does also give regional governments some powers to try to stop the spread of virus. Each region will be able to apply its own measures after central and regional governments clash on the best way to battle the pandemic. The central government hopes to extend the state of emergency until May next year, but for this they need the backing of other political parties, and that won't happen without a fight. Meanwhile, COVID cases continue to spiral upwards. Marta, Herrero, Jazeera, Madrid.